Hello, I'm Jim Byrne, and I'm delighted to discuss with you an exciting new service and technology that's made its way to the Central Coast. It will vastly improve the lives of anyone suffering from a poor smile or, worse yet, bad teeth and gums. I have with me today Dr. Perone de Quiros, head of the Central Coast Dental Implantology Center. Dr. de Quiros, welcome. Tell us a little bit about yourself and this exciting new service and technology that you're bringing to the region.
This new technology I'm bringing to the Central Coast is called DioNavi. It's a way that uses digital technology to be able to place implants precisely with no cutting, no suturing, and minimal bleeding to the patients.
Well, tell us a little bit about your background and why did you decide to call the Central Coast your home?
Well, Jim, I've been in private practice for nearly 23 years now, and the last 18 years has focused primarily on dental implants. I attended Loma Linda School of Dentistry from 1991 through 1995, and at that time, Loma Linda was the only school that provided postgraduate training in implantology. So I was lucky enough to work with the most doctors who started this field of implantology. So I had an early start. I'm also a fellow and a diplomat of the International Academy of Dental Implantology and International Congress of Oral Implantology. Both societies focus primarily on the advancements of oral implantology. I recently relocated to California from Arizona about 7 years ago, and I've had the opportunity to work up and down the coast of California, and Central Coast is where I decided to stay because, as everyone knows, it's a very beautiful place to live.
That's right. Can't go wrong with our weather and climate and the location next to the ocean. Did you see a need for this new service here on the Central Coast?
And that's another reason why I decided to move to the Central Coast. There is a great need for someone who specializes in dental implants along the Central Coast. There's only a number of doctors that are able to place dental implants in this area.
So this is groundbreaking. This is different from historical implants or dentures. This takes it to a whole new level.
This is absolutely groundbreaking. And as far as I know, as of today's taping, I am the only provider, I'm the only doctor along the Central Coast within 100 miles of my office that provides this technology.
This is a one-of-a-kind thing, as you stated, but do you see a demand for that?
Yes, Jim. There's a demand basically anywhere. There are 23 million people that are edentulous, meaning they are missing teeth in their upper arch or the lower arch. Another 12 million are missing teeth either in the upper arch or the lower arch. And 90% of these patients, Jim, they wear this denture. This denture is over 100-year-old technology, Jim. And up to today, patients still wear it. Just look at this. It's plastic.
It looks like Halloween teeth, to be honest with you.
It does. And most patients that I've seen who wear dentures, they're basically unhappy with them because they don't fit well, they hurt, and they're not able to chew with them. This is old technology.
Yeah, they slide. They don't stay in place.
Exactly.
Yeah, interesting. When we come back, we'll dig deeper into Dr. de Quiros' groundbreaking technology and his wonderful service. Again, very unique to the Central Coast. We'll talk more about that when we come back. Stay with us. Welcome back. I'm excited to talk to you about a new exciting service and technology that has arrived to the Central Coast. We learned a little bit about Dr. Perone de Quiros. He is the leader of the Central Coast Dental Implant Center here in Santa Maria. Talked a little bit about his background, his dental implant background, his dentistry background, but now we're going to get a little bit deeper into the service and the product itself. Doctor, welcome back. Well, what distinguishes the DioNavi process, the implants associated with the DioNavi process, and let's say dentures?
The biggest difference, Jim, between the two is that unlike a denture, which you need adhesives to make it stay in your mouth, in the DioNavi process, once the implants are placed, we also attach the teeth into place. So the teeth are stable, they're very durable, unlike a denture, and you'll be able to chew on them and function in them immediately. Okay? And the cost of this is equivalent to saving a tooth itself.
Okay, so with the DNAVI process, that in itself is a new technology that has basically developed over the last few years. How does that differ from traditional implants? Is it a new implant technology? I mean, implants have been done for a while, right?
That's correct. But this is just a new way to place dental implants. Again, without cutting, without suturing, and less pain for the patients. That's the most important part.
What is DNAVI? Can you briefly describe to us what that technology is?
DNAVI technology, we need information. We need data. And the data, we acquire two things. One is information of your bone. We get information of your bone by getting what's called a CBCT, or cone beam CT.
When we say bone, jawbone, correct?
Jawbone, upper and lower jaw. And this CBCT will show us in your jawbone in 3 dimensions. And then the second data that we need is your teeth and gums. And we use a special scanner that takes images of your teeth and gums. And once these data are gathered together, we merge them so that we are able to create a virtual model of the patient's jawbone, including their teeth and gums.
Gotcha. So it's that model that you actually create and understand where you're going to need to have the implants or
yes.
the guides.
Yes, we actually pre-plan the entire surgery before the procedure itself. So everything is done in the computer. And once it's treatment planned, I go over that with the patient, and we follow the protocol. We need a few days to make the surgical guide. It's a surgical guide that we need to make.
Gotcha. And those surgical guides are sort of like molds that you'll put over their bones, their jaw, the upper jaw or the lower jaw, and that'll give you an idea of where to actually drill?
Jim, this is an example of a surgical guide. You can see these holes. They're very small, and I'm able to precisely place the implants in those areas. And as you can see, there's no cutting, which means no suturing, and very minimal bleeding. And unlike traditional implants, I'm able to put teeth on these implants on the same day. Traditionally, we had to wait 4 to 6 months to be able to place teeth on the implants.
Wow. So that's the same day. A person can walk in and get that done in the same day.
Yes, that is the big difference between the old way and the new way, Jim. And the patients that I've treated, they're so happy when they walk out with teeth that are not only good looking, but they're able to function with them.
Yeah, you basically have transformed someone's life in a matter of a couple of hours. When you do the cutting, you said with the drilling, you don't have as much bleeding, less suturing. That actually helps in the time and increasing the time and being able to get these implants put in.
Well, since the gum is not cut open, okay, we preserve the blood flow, and it's the blood flow that's the most important in the healing process. That's why the healing is so much faster than it was before.
Okay, and that reduces the risk of infection as well, I'm sure, right?
That's correct, because everything through the process is done entirely less invasively and exactly as we planned from the computers.
Wow, that's fascinating. Okay, when we come back, we'll talk more about the DNAVI process, get into some of that technology, and we'll talk about some patients as well. Some of those patients that he's transformed their lives because of his service and the mastery of his service. We'll talk about that when we come back. Stay with us. Hello, I'm Jim Byrne. Welcome back. We're here with Dr. Perón de Quiros. He's the head surgeon at the Central Coast Dental Implant Center in Santa Maria. We touched a little bit about the amazing technology that is known as DNAVI technology. It has vastly improved the quality of dental implant surgery. Doctor, welcome back. Can you describe to us in a little bit more detail the DNAVI process?
Well, Jim, it's quite simple. It's a two-step process. First step is we need to gather data of the patient's jawbone. We gather data of the patient's jawbone by taking what's called a cone beam CT. Once the cone beam CT is done, we take an intraoral scanner to take pictures of the patient's teeth and gums. Once the patient's teeth and gums are gathered, the data are gathered, we combine them together to create a virtual model of the patient's mouth. And once this model is created, I use a special software where I actually treatment plan and plan the actual procedure.
So this is where the real technology comes in, not only with the scan data, but with the proprietary software that gives you, I guess, the precise locations where to create the guides.
Jim, it's amazingly precise. I have used other systems before, and I was just very disappointed with them because I had actually to abandon the surgery because I knew the implant wasn't going into the correct position.
Ooh.
But with this new technology, every day I do the surgery, I'm always amazed at how precise it is.
Great, great. So exactly, if you can step through it a little bit more. So we have the merging of the CT and the scan data, and now you're looking at a model, a 3D model.
A virtual model, yes, a three-dimensional model of the patient's mouth, yeah, with the teeth, gums, and the jawbone underneath.
And then the next step is to create the surgical guides?
The surgical guide, yes. First, when I plan it, I plan where the teeth need to be, because that's the most important part. And once the teeth are placed, then I determine where the implant position needs to be. And once those things are treatment planned, then I create the surgical guide. I plan the surgical guide. And once the surgical guide, the teeth, the temporary teeth, and the implants are planned, then we send it off so that the company makes us the surgical guide, and the temporaries arrive on the same day.
Okay, and so when the patient comes in for the surgery, you place the surgical guides over the person's jaw, whether it's the upper or lower?
That's correct. That's correct. And again, just with local anesthetic, okay, local anesthesia, we're able to place these implants with no cutting, no suturing, and very minimal bleeding, okay? I've never had to prescribe anything stronger than an ibuprofen for these procedures.
Wow, wow. So that's where this technology has really jumped leaps and bounds over conventional technology.
Yes, yes, that's
So with less bleeding, obviously that means less infection?
minimal infection because we are not cutting the patient's gums anymore.
Great, great. So once you have the surgical guides in place and then you begin to drill into the jawbone using the guides, what's next?
What's next is we attach what's called customized abutments, okay? These are the customized abutments that are attached to the implants that are already in the patient's jawbone. And then these temporary teeth go over the customized abutments, and they're cemented or either screwed into place.
Okay. Interesting. So that's a big difference from a floating denture.
Big difference. It is a world of a difference. My patients tell me, why did I wait so long to do this procedure?
Well, that's fantastic. And so you have initially temporary teeth that is put in over those dental posts. What is it? Are they posts? What do you call the actual rods that are that the teeth go over?
These are called customized abutments.
Abutments.
Yes,
Okay.
these are the abutments. They connect into the implants themselves.
Okay.
And these abutments is what holds on to the patient's teeth.
Okay. And initially they're temporary.
That's correct. Temporary because we need for the gums to heal. And healing process for the gums is normally about 8 to 10 weeks. And that's about also the same time when the bone is fully integrated into the implants. So now we can proceed in making the final prosthesis made out of either zirconia or porcelain or both.
And they're just as strong as natural teeth?
They're very comparable to natural teeth.
Yeah. Okay. And how about cavities? Can you get cavities with the zirconium?
That's the great part. No more cavities for the rest of the patient's
Wow.
life. Okay?
So not only are you transforming people's lives, you're giving them a better smile, you're boosting their self-esteem, but now they're not going to have any cavities as well.
Yes, and it is life-changing.
Wow, that's fantastic. So you can check out more about Dr. DeCuros' wonderful service and technology by visiting his website at centralcoastdentalimplants.com. When we come back, we'll talk about some of the folks who have benefited greatly from his technology and service. We'll talk about that when we come back. Stay with us. Welcome back. I'm Jim Byrne. I'm with Dr. Perone DeCuros from the Central Coast Dental Implant Center in Santa Maria. We've talked about the D'Anavi process and his amazing technology and service that he has brought to the Central Coast. And now we're going to talk about some of those patients who he's vastly improved the quality of their lives because of his technology and what he's bringing here. Doctor, welcome back. Let's take a look at some of these cases that you have here.
Yes, let's go ahead and do that. First case here, Jim, is Sam. He presented to me with very loose teeth. I mean, he suddenly said, "Doctor, my teeth are just splaying out everywhere, and they're very loose." He's a 59-year-old male, and he's been diagnosed with advanced or severe periodontal disease. So as you can see, his teeth are just splaying out, and it's coming out of his gums because of the severe gum disease. And because of his inability to eat properly, his blood sugar is also out of control.
And that has to be pretty painful as well.
It's
right?
very, very painful, and
Yeah.
that's what brought him to my office, is
Yeah.
he can't chew.
Wow, look at the difference here with the permanent crowns.
Yes, as you can see, it's very lifelike and natural looking. Pretty much he can eat anything he wants now.
And so this has dramatically improved the quality of Sam's life. What kind of emotion did you get from him when he saw these for the first time?
Well, first, he cried, actually. When I finally showed him how his teeth are going to look like, he cried. He said, "These were how my teeth looked like 40 years ago." The most amazing thing, outside that he's got a beautiful smile now, because we've eliminated the gum disease. He's able to eat properly, better diet, and with that, his blood sugar is under control.
That's fantastic, and that's one of the patients that you have that we've looked at. Let's take a look at patient number 2 now. We have Kristen here, 30-year-old female. She's worn dentures for the last 5 years and has a problem eating, and that's also played into her social life. Can you explain here?
Well, as I showed previously, dentures, you need dental adhesives to make them stay in your mouth. It's very painful to wear with them, and she's just one of those unfortunate patients who's been suffering with dentures. So this is how Kristen came in, and after treatment planning, this is how she walked out. As you can see, the implants are placed, the temporaries are placed, and also you can see before she came in, she had wrinkles around her face, and with the temporary teeth in, we were able to change the smile.
Do you find that to happen to be the case quite a bit with new implants?
Yes, quite often. Yeah, once we are able to correct the patient's bite, put the teeth where they need to be, the face completely changes.
Is that right? What causes that?
Because when you lose teeth, your face collapses and your muscles fall down. So once you correct that to where it should be, the muscles go back where they need to be.
So the muscles are actually regenerating with the implants?
They're not regenerating, they're just being repositioned where they were supposed to be.
Oh, interesting. Okay, so that was Kristen. Obviously, you've helped her smile out quite a bit. She's able to go out more. She's able to smile and not be embarrassed like she was before. That's a great story for Kristen. And she's probably got a great diet back. She doesn't have to worry about what she eats. All right, patient number 3, we've got Brian here. He's a 66-year-old male. His teeth, you can see they're severely worn down from clenching and grinding. Now, I know a lot of us do that. That's what can happen after years of clenching and grinding?
Brian, because of his clenching and grinding issues, broke down all his teeth. So we took him from broken down teeth to having all these perfectly positioned teeth again.
Through the use of those implants that you can see there on the screen. Wow, so he had that many implants put in.
And one of his issues is he couldn't chew properly. He wasn't able to break down his food properly. So with having teeth again, as you can see his big smile here.
Yeah, boy, look at the difference between the before and after. That's a wider smile with the new teeth. That's fantastic.
That's correct. It just changes a person once you get your teeth back.
Sure, that makes a lot of sense. All right, finally, case number 4 here. We have Roman, a 45-year-old male with broken front teeth. Can you explain to us what's going on here with Roman?
Well, Roman has been living with these broken teeth for a while now and is basically just tired of living like that. So this is how it presented to me with those broken teeth. And we placed 2 implants, attached 4 teeth to the implants.
So you can see there on the left side, those were his original teeth that were damaged.
Yes.
And on the right?
Are the 2 implants I placed. And again, using the Dio-Navi process, not am I only able to place the implants, I'm able to attach 4 temporary teeth to those implants. We don't have to wait the 4 to 6 months anymore.
Wow, okay.
This is immediate.
So this was what he looked like before.
Yes.
Obviously, he needed a lot of work done, and this is what he looked like afterwards. Explain to us what we're looking at here.
And these are Roman's final crowns. They're made of porcelain, and you can see they're very lifelike. And again, Roman didn't leave at any point did he not have any teeth. So throughout the whole treatment, he had teeth attached to the implants.
Wow. So is this the temporary or is this the permanent?
That is the permanent crowns.
Nice. Wow, what an amazing difference. So what was his reaction? It has to do a lot for self-esteem and self-confidence.
Yes, because, you know, smiling is the first reaction that we learn when we're first born. You know, we're laying in the crib, our parents look over us, and they smile, they smile. And that's the first thing that we learn, is to smile. And once you lose that ability to smile, it actually changes you as a person. You become unhappy. And that's the common thread amongst all of my patients. They want to get their life back and be happy again.
Sure. So they were handicapped when they walked into your office, but when they walk out, they're not, and they have this new sense of life almost.
Because they have teeth again, and they can smile again.
Right. That's fantastic. This is huge. Dr. DeKouros is changing the lives already of many folks here on the Central Coast. So why don't you reach out to him? Either check him out on his website at centralcoastdentalimplants.com, or be sure to call Dr. Perone DeKouros at the Central Coast Dental Implant Center in Santa Maria. Stick around as well. We are going to be posting a number of shows. We'll have a YouTube channel up. We'd love to hear from you. Any questions, comments you have for the doctor, he wants to hear that as well. So stay tuned for that. We have a lot of exciting shows to come up here in the next couple of months, and we want you to check those out. So stay tuned for that. Doctor, thank you very much for coming on our show today.
Thank you, Jim.
Thank you. And I'm Jim Byrne, and we'll see you soon. Thank you.